Welcome to The Whole View. I'm Stacy Toth of Real Everything. I'm here each week to dive deeper into how we can find happiness and health inside and out through self love, body positivity, and discovering new ways to be our best selves. Before we get started, a reminder this podcast is for general educational purposes and is not intended to diagnose, advise, or treat any physical or mental illness. And while we have two doctors with us today, they aren't yours. And we always recommend that you see a licensed health professional accordingly. I am really excited to welcome back Dr. David Sitt and his wonderful wife, Ayla, who we actually spoke about the first time that David and I had our show together on his book, ADHD Refocused. And I got a lot of benefit out of that show. I know a lot of listeners did. And so I'm excited today to dive into also areas of focus as it relates to women in ADHD, women's health and anxiety, and your spouse and partner, Ayla Sitt. Both of you doctors are here today to share your wisdom with us. And I will say, listeners, before we got started, there have been many cute, like little marriage moments, and I'm sure you've got a show to look forward to here. I thought it'd be fun. David, maybe you could introduce Ayla for us, and then Ayla, you do the same for David.
Hey, awesome. I'd be glad to. So it is my pleasure to introduce the brilliant, the beautiful, the ever presently inspiring Dr. Ayla Sitt. I'm not biased at all in that. Ayla is a clinical psychologist who's been in practice nearly 10 years, focusing on the areas of anxiety, meaning generalized anxiety disorders, obsessive compulsive disorders, phobia, and engaging in very difficult and effective treatments for those areas, but also having a focus in the area of women's health, supporting women who are challenged with fertility issues, whether going through infertility and needing psychological support through those journeys, or moms, fresh new moms into the new momhood. Ayla runs great therapy groups for new moms and one-on-one therapy for that population, and has a whole bag of tricks from the CBT and dialectical behavior therapy world. And I'm sure we'll hear a little bit about that today. And that is also formerly a professor of psychology at Baruch College in New York. How'd I do, Ayla? How'd I do?
You did good. Definitely added a lot more than I would have if I introduced myself. And I'll introduce David. So, Dr. David Sitt, otherwise known as the professor, who works at Baruch College for over 20 plus years and has been a clinical psychologist in private practice for over 15. David specializes in adult ADD, and through his own personal experience with ADD, where he was diagnosed in graduate school for psychology, he recognized this missing piece in the clinical world of how to treat adult ADD. And he put all of his efforts into research and to figuring out how he can both help himself most effectively and then help his clients, and was able to write a book called ADHD Refocused, which includes all of his struggles to effectiveness over time. And David also has a lot of hands in different areas. Agave Health, which is an app he works on, and I'm sure we'll get through that. But as an EDD mind, he has lots of interests and does lots of things. And so,
And you're both parents to 4 children,
yes,
so
we are
not
both
busy at all.
right. Exactly.
Well, I think the intersection of where your work overlaps that I'd love to start the conversation is the idea of neurodiversity and how it can also affect mental health. And especially in women, I know that I have a ton of personal friends who have been diagnosed as adults with ADHD in the last 5 years. And I think a lot of listeners, also, David, when we did our show, a lot of listeners reached out and was like, I would love to hear more about ADHD in women because it is such an underserved community. It is not as well understood. And oftentimes we physically see the symptoms of biological males showing their inattention in school, right? Like they're a lot more physical in the way that they show those symptoms. And it can manifest, I think, into adulthood, into a variety of different things that we either overcompensate for or we cope with in not wonderful ways. And for those people who are now eyes are opened, maybe during the pandemic, they were stuck in their house and they couldn't like do whatever and get that energy out and now have been diagnosed, they're starting life over, understanding themselves in a different way, as you and I talked about, David, earlier. So I would love if maybe we could start there. I think there's a lot of things that I'm very much looking forward to talking to you both about. But David, could you maybe start with like how in your practice, women being a different kind of diagnosis or presentation. And then, Ayla, I would love to hear your perspective too on how that manifests in other areas of mental health and how we can, as women, support ourselves that way. And when I say men and women, just for the preface of the show, I am talking about biological because I do think that it plays a large role, but there's also a gender factor. I think in this younger generation, for people who are identifying from a younger age, maybe they're learning and the behaviors that are expected of women, right? Like perhaps could manifest in different ways now that there's more supports in school and stuff. But for the purpose of our conversation, I think the generalizations are applying just to gender stereotypes and physicality and on all the kind of things that exist.
Yeah, I think those are important points to lay out in the way that we have these conversations today. Stacey, I'll back up and just give a quick context here for ADHD. According to the Center for Disease Control and Prevalence, the CDC, the overall prevalence of ADHD in the adult population here in the US is about 4.4%. Now, there are studies that show as high as 10%, meaning 1 out of 10 adults in America are experiencing ADHD. In children, the ratio is 2 to 1 for male to female in children in the diagnosis, right? As we move towards adulthood, the gap does narrow. The study shows somewhere like 1.6 to 1 prevalence or in the presentation, somewhere around 3.5% of women in the US adults are found with ADHD. So there are these differences. And then the question is why? And is it accurate? Right? There are certain conditions like schizophrenia, more extreme, which are very much biologically based and genetically based. It's a 1 to 1 ratio. You have other disorders like depression, we see a significant disparity. And so there's this question of what are the variables that affect presentation. In the ADHD world, we know, in fact, I had a friend came up to me very recently, Ayla, we were together and a friend came over to us, a woman who we know, and said, I've just been diagnosed. I just read your book, she told me, David, I read your book and it blew my mind because I was reading me. You were speaking my world off the pages. It was me, but no one ever assessed me. And this is a woman who's very successful, who handles a lot and is always busy and running around managing her family and her job and her volunteer positions and the school. And she's running on a mile a minute. And she said, that was just me. And in school, I was on every committee. And no one ever stopped to tell me I had this propensity to do things at the last minute or that I was distracted unless I was highly stimulated. No one ever thought. They just think, oh, let's say her name was Jennifer. That's the way women are. They're just running around with doing a lot of stuff. And she was heartbroken about the fact that this was missed all these years. She's in her mid-40s now. And so it's common to misunderstand, not because we're not seeing that if it's the hyperactive and impulsive piece, it's not as visible as you said, Stacey, as it might be in young and boys and adolescent boys. And we're more commonly realizing that there is a more inattentive presentation for ADHD in women. And if there is impulsiveness, it might be in speaking, might be impulsive conversation. It might be in very different ways than the very loud ADHD boy that was there or man that presents. So there's clearly differences that we're catching up to be able to see. I'll pause with that.
I love the story of Jennifer because I think it speaks to the ability to harness neurodiversity as a superpower. And I think of my youngest son who has mastered history. Like he has a professor level understanding of history because he also is on the spectrum, right? And so he has dived very deep and knows everything there is to know. And I think about Jennifer, who has like harnessed her superpower to do all of these different things. And I think it is sad to think that for those people who are feeling all over the place and are wondering what is wrong with me instead of feeling like, oh, look at me, I can do all the things. We're left with this, well, why didn't anyone care enough feeling? Which is where, Layla, I think your work intersects and is a lot of overlap because there's a lot of the other diagnosis, David, that you were mentioning that is commonly associated with ADHD, anxiety, depression, different kinds of things that can be associated because of a lot of the misunderstanding or worry of perception and all those things. So, Layla, I'm wondering if maybe you can speak to specifically how, when you're working with women, some of this presents. And as a woman yourself, I think you probably have a better understanding of the expectations, societal pressures, and those kinds of things that can also play into some of these factors.
Yeah, definitely. And I think what's really interesting, and what I've also heard feedback from David's book, I've had a few friends reach out to me, like childhood friends, and say, oh my gosh, I had ADD and nobody told me. Right. And I didn't know. And now all of this makes so much sense. So I think what's also important to recognize is not only were they not diagnosed, but it did have impact, right? Like they did feel like they weren't smart if they didn't do well in school. They did think that maybe their brain's different than other people's, but didn't know why, right? Despite their best efforts. And that impacts how you feel, right? That impacts your belief system about yourself. Like, oh, I'm not a school person, or I can't get jobs in this type of area because that's like not what I'm good at. Rather than being able to understand my brain works differently and I might need to go about looking for a job that sort of pulls for my strengths, or learn tools so that I can succeed in a job that I want, but maybe isn't something that had comes so naturally to me. And so in thinking about, anecdotally thinking about some of these people that, some of these women who then came into adulthood, it's interesting to see that at least partially they did go into areas that spoke to the positive, more like superpowers of ADD. They sales. Many of them went into sales where they got to use their personality and their creativity. And oftentimes, people with ADD have creativity. They have big personalities. They know how to connect to people and make them feel special, sometimes more than your average person can. And so, sales and customer relations and party planning, right? Very person focused forward types of jobs. Um, that being said, it's not all rainbows and sunshine, right? When your brain isn't working the way that you want it to work, that is extremely frustrating. And it's not for a lack of intelligence, and it's not for a lack of potential vision. It's almost too much vision and having difficulty figuring out how to make my vision come to fruition. Like, what are the first steps that I'm going to take? How do I get there? And why can't I? And very often, once you are able to help them see what's happening, oh my gosh, it makes the world of a difference. And I would also share what I've noticed in women that I work with who have a diagnosis of ADD. Very often they come with this counterbalance of perfectionism, which is really interesting for two reasons. One is I find that it's very hard to help them with the perfectionism because in some ways it's effective for them. That's what helps them overcome this, like, I need to get this done, but I don't know how to do it. Is, well, I got to get it done. I'm going to get it done because, like, that's what I need to do. And that will make me feel great. And then at the same time, oh my gosh, how hard is it? And the second they make one mistake or something doesn't go exactly the way that they wanted to, failure, what's wrong with me? And so even just bringing that to their attention and helping them see these two components fighting with each other and letting them create systems while also being okay with this idea of flexibility, and sometimes you're going to make mistakes, is really the balance that I try to help them with.
I think it's a really good picture of this idea of perfectionism. And I think that there's a lot of women who I know listen to the show and who are in my life because we had autoimmune disease, right? We all found each other. And I think there's that overlap of the perfectionism and the high expectations and the stress that we take on that also is like a physical burden in our body that leads to a higher propensity for autoimmune and other kinds of things. And so I'm hearing you speak about this, and it has always occurred to me that I probably have ADD and everything that you're saying, both of you. And I am also one of those people who did the overcome, right? I learned how to multitask. I learned how to lean into it as a superpower. And I think knowing now what I know, I wouldn't necessarily personally change anything, but I do think that for those people who are not in a neurodiverse relationship, right? Like my husband and I kind of magnet to each other, and the areas where this does not show up for me is I'm very much not an 80 percenter, as we call it, right? Like they'll do a task and they're like 80% of the way through the task and then they get distracted by something else. And for me, that happens, but then there's like a part in my brain that catches and I'm like, "Oh, I have to go back and I have to do the thing." Oh, and then so like it's just constant for me of like, "Oh, and this thing and then this thing and then this thing," where my partner, my children who have that, it does not catch for them. Like, it's like they get distracted and then the dishwasher is left open with 20% of the dishes still in it. And so I'm wondering how you both work together as in partnership, but also how you help the people that you work with in being in a relationship with someone with ADHD. And I have some specific questions that I want to ask around this that I think, but it would be good to start with just like generalization of compassion, understanding, and also like what someone could be really good at and to lean into those things.
I think I'll jump in and on this point say that Ayla and I have, it's an ongoing process. And when I think about my own ADHD and how I try to help other people, the two things that I always focus on are methods, right? Certainly things to do, methodologies, hacks, tricks, however you want to refer to them. But the mindset as well is crucial. And a mindset is not a fixed a variable. It is a growth variable, the growth mindset, perhaps even you might say, something that is a work in progress. And so I think, and I'm curious to hear, Ayla, what you'll say about this. We try our best to provide flexibility in the process of the mindset, because that's the long game. I might mess up. I might forget to call to fix the washing, the laundry machine, which is broken right now. And I put it off for a week and we're washing hands by close my hands now, right? We may have things like that, but the long range mindset is crucial. And that's where it starts. I'll pause there.
Yeah, I'll say a few things. One is expectation. David has consistently, since the moment I met him, been the last one to leave if we need to get somewhere, right? We need to be somewhere at 5. We're not leaving till 5:10, right? So I could understand 5:45, 6 o'clock. I could understand somebody's frustration coming up. But for me, like I mentally built in that window of we're gonna walk out the door at 5. That might actually happen. But then David's gonna say, wait 1 second, I'm just gonna check if I shut off the light. Okay. Then I know he won't be back for another 10 minutes because he's gonna go inside, he's gonna check the light, then he's gonna check all of the lights, then he's gonna check the air conditioner, then he's gonna remember he maybe left something in the other room. He's gonna go want to get that. Then he's gonna say, oh, but let's say it rains, maybe I need an umbrella. And then there's gonna be 40 different things that he thinks about, and he's gonna be out 10 minutes later. And so what I do in those 10 minutes, what one might have the urge to do is sit there stewing, I got ready and he's always late. And now I'm sitting here and I'm angry and I can't believe it. And he doesn't care about me. He doesn't care about my time. I could do that. Or what I actually do is I've downloaded Kindle on my phone and I'll start reading a book.
Nice.
Right. And I know he's going to get back, or I'll answer emails, or I'll make a call to a friend. And I'm going to make that time not feel as if it's being wasted by his actions. I'm going to do something that's within my control that will not get me stewing on something that I know is not likely going to change. And David has done his work in that we are leaving at 5:10 and not 5:45 or 6 o'clock, right? So to the point of David speaking about flexibility is you can't expect somebody to be a different person if there's something that they struggle with. The hope is that it improves. And for him, it has improved. And so I'm working on myself so that doesn't become a daily conflict because that's not going to help us. That's not going to help him. And one thing that we also know is that when somebody does have ADD, they also have high rejection sensitivity. They already have their own personal, why can't I do things in a timely fashion? And so the last thing that's going to help him be on time is me being like, why I'm in here waiting and no. Like that's not going to help anything. I'm not saying don't voice your frustration. I think it's completely normal and valid to voice your frustration. I would think about when you do it and how you do it. But I do think that it's important to be flexible. Just like I might be a more anxious person and David needs to learn to be more flexible with the things I might bring up that he thinks are ridiculous. Right. So we both have to do that give and take.
I It's interesting hearing you tell that story because my husband is the very first person who is ready, and his anxiousness is on all of us not being ready, right? And so it's not necessarily only presenting in the way that David is showing up with his processing of how and what needs to be done in order to leave and then distractions in the house, but it can also show up is anxiety in the person, right? And so my husband is very anxious, like worst case scenario type things if we're late, and also coming from rejection sensitivity and social anxiety, like not wanting to walk in late and what the implication might be in terms of how someone would perceive that. And so in our marriage, I am never on time. I am always the person who is late. I always think I can squeeze in one or two more things. And that was something that really challenged us for the first 10 years of our marriage. And then once we had, at that point, 3 children, he gave up, right? He was like, "Okay, we're just gonna be late, and I've learned that this is okay." But I think that the point is that it can manifest in a bunch of different ways, and we as partners, as you both have said, need to kind of understand that this is the person that I've married and this is who they are, and nobody is perfect, even if you strive for perfectionism. It does not exist. There is no such thing as perfect, and so for me, I think to myself, there's so many wonderful things about my partner and the way that he shows up for me. In this particular instance of forgetting to finish unloading the dishwasher, I can let that go. Where I have a really difficult time, and I'd love to hear both of your perspectives on this, is the rejection sensitivity causes both my husband and my youngest to lie because they don't want to admit that they have done something impulsively or that they've forgotten something. And as just part of my personality, I am I really value transparency and honesty and openness. And so that is a place that we have really struggled in our house that I see oftentimes online. It's like, how you know you're in a good relationship. Like the person is always honest with you. And I'm like, I've been in a 22-year relationship that I would say is really strong and healthy. And my partner has lied to me countless times. And I know that it's because of rejection sensitivity. I know that it's because he is disappointed in himself not to do something. But it took me a really long time to understand that. And I'm wondering if you can both speak to some of these other symptoms that might happen in other relationships that I'm not even aware of because it's not happening in mine, where some of these things come up that partners kind of understanding and leading with compassion would make a huge difference in the relationship.
It's really, I think if we speak, if we had a 3-hour conversation, we would pop up 30 different examples because there are so many ways that this manifests. And I think Ayla gave a great example, and Stacy, your example also is very poignant. I'll add another example. I find that as the ADHD, as the primary ADHD adult, and I tease Ayla that I think she's on the spectrum somewhere, right? Definitely not
And
on
we
the
all find
extreme
each other, right?
right, right, 100%. but I fall a lot into impulsiveness, and that affects Ayla and I and our children as well. So I'm inclined to say something without thinking, doing something without thinking. Ayla, there was something that happened just in the past day. I forgot. I don't know if you remember what it was. It's escaping me in the moment where you said, David, I wish you wouldn't, I wish you would think before you said what you said. Right. And I just threw my hands up and said, me too. I also wish I was able to do that, but I struggle to do that. And sometimes I'll be defensive about it, but more than not because of the mindset. I am aware that I fall prey to that. I'm aware that I'm more inclined to buy something on Amazon without really thinking it through. Or I went shopping and I bought things at the grocery store without checking to see if we had it already. And meanwhile, we already had 2 cans of syrup. I don't know. I'm more inclined to that. And that comes up for Ayla and I, and it can cause a lot of tension. So Ayla, I'm curious to hear if does that example resonate with you, or is there another one that resonates with you?
I wouldn't call it cans of syrup, but what I would say is I would say a few things. One is that I think it's really important how the partner responds. And Stacey, I think you were mentioning that in like responding with compassion. And I think that can make all of the difference. Right. So I know like with my kids, for example, who also potentially, if we've like caught them doing something impulsive, might be like, yeah, no, this is what happened. And I could tell I'm a lie detector. I can tell when somebody is lying to me. And so one thing that I've started to say is when you tell us the truth, we're able to help you in the most effective way in whatever language per age. And I'm not going to be upset at you if you don't tell me I'm not gonna be upset at you if you tell me the truth, even if I don't like what happened. So like letting it be a safe space where they know that I really do want to hear the truth. And to other sort of impulsive behaviors, I think that both thinking about is now the time to respond in moment, or will I wait till later when maybe we're out of that moment and then say, hey, I really didn't like when you said that in front of our guests, for example. And then for David's part, because something that I think is also really important is I tell all my patients, all my clients, regardless of what you're struggling with, it doesn't give you a free pass on behaving in certain ways, right? So it's extra difficult for you and you need to figure out how to handle some of those behaviors, right? So somebody who says something impulsively, you don't just say, oh, it's okay, they have ADD, now they can say whatever they want, right? So I will have those conversations too with David, but maybe in a time and a place where I think he's most likely to be able to hear me and in a way that I'm not being critical, but more informative and wanting things to improve.
That's more
I think Ayla's, again, the timing is crucial. I think that's a brilliant point, and it happened to us this weekend. We were out somewhere. We had dinner by a friend's house, and I think I did say something that Ayla didn't appreciate, and she didn't make an issue of it on the spot where it could have erupted right then and there, right? But Ayla had the foresight to say she logged it, and later on, even I think it was the day later, we spoke about it. And I was able, again, the rejection sensitivity, if it happened in the moment, I would have been in the red. I would have been defensive. I would have been emotional. I would have went from 0 to 60 in a much more intense way, protect myself. But yet the day later, we had time, we had space. She was compassionate about it. And so I think that does make a difference. And our listeners today who are listening to this, we should all try it out, try to give yourself that pause. And you might even tell the person, listen, we need to talk about this, but not now. Let's put a time tomorrow, because what's happening is it's not feeling so great for me. Let's talk about it tomorrow. Okay. And make a plan to do that. Yeah, I would echo that. I could spin off other examples, and we can, if
Yeah.
Stacey, if you like, you want to go there.
Well, I'm actually thinking, so as you were describing it, and especially the rejection sensitivity and acting in compassion and coming to things later and being aware enough that if you were reacting in that moment, you would have been defensive. Like, what strikes me in all of that conversation is that really CBT and DBT are being practiced in your home in terms of how you're approaching um, the behaviors. And I love what you said about it's not a pass for behavior, right? And I'm also a foster mom of severely traumatized teenager who struggles in a lot of different ways. And it doesn't mean that I'm not compassionate and understanding of the horrors that this person has lived through. And at the same time, it is not a pass to relive some of those coping mechanisms or behaviors that they grew up with in a different environment that is loving and is compassionate and those kinds of things. And so we've gone through a lot of CBT and DBT training and all that kind of stuff. And so I would love maybe if Ayla, you can talk about your experience with that and how it can show up in relationships, like as a mom, as a partner, but also for those of us who are just like living our lives and wanting to be better people. I definitely did not learn those skills when I was younger. And I know that I'm a better person myself personally in processing my own emotions if I practice that with others as well. So I'd love if maybe we could talk about that a little bit. What even is CBT and DBT? Maybe we should start with that for listeners.
Okay. Yeah, there's so much to say. It was a broad question with so many different angles and directions to go. So generally, what I would say is CBT is called cognitive behavioral therapy. And essentially, the overall idea of CBT is that our thoughts affect the way that we feel and then the way that we behave. So for example, if I had the thought that I'll use that example we gave before, if let's say David said something, let's say we're at dinner and David says, "Oh, this doesn't taste good to food that I made," right? So I have the thought, wow, like he's so insensitive. He doesn't think before he acts. Then I feel anger. And then my urge for my behavior might be to be like, wow, David, that was really thoughtful. Glad I made you dinner, right? But imagine we have guests in front of us. That's not likely to be effective, right? If I had the thought, David didn't mean anything by it, he just didn't like the taste of the food, then I might say, okay, my emotion's really neutral. Like, I don't care who likes my food and who doesn't like my food. I tried my best and I wouldn't have an urge to do anything. So, so basically the idea there is that the way that we think or the interpretations that we make of situations impact how we feel or the intensity of the emotion that we feel, right? Like maybe I would feel like sad versus angry if he didn't like my food, and then it would impact how I behave afterwards. So that's the idea of CBT just generally. DBT has components of CBT within it, but then it's had other philosophies and different types of it's like a huge book of skills where it gives you different tools to use in different types of situations, helps with how to communicate most effectively, how to stay present, how to regulate your emotions, and then how to get through difficult times without making things worse, essentially is the idea of using all of those tools. What I would say is, to your point, I believe in what I do. And so I use the tools that I teach. And to what you had mentioned before, none of us are perfect, right? I think I know I have some clients who be like, Ayla, you probably don't struggle with any of these things because all of the tools. And I'm like, no, I'm still human, right? I still have emotions. I still get upset. I still react not in the most effective ways at times. And so I try to,
Ayla,
what I
that's
would
not
say,
true. You are perfect, Ayla. You are
all right, Dan. So what I would say to your viewers is think about the areas that you struggle the most, right? And then I would think about how you want to build up and work on those specific areas. Just to give you an idea, I know for many people that I work with, and I know even for myself, judgments and interpretations are a huge component of what might make me feel a certain way. And so I try really hard, which is a skill in DBT called non-judgmentalness within the mindfulness module. And it's recognizing your judgment and then trying to describe what it is based on the facts in front of you. So if I were to say that person is mean, that's a judgment word. So instead, I might say, when I ask them something, they often say no. right? So it just, when we describe things in a less judgmental way, it often brings down the intensity of our emotion. It also gives us the opportunity to make change, right? Now I have something either I could choose to talk to that person about and say, hey, like, I realize that often when I ask you something, you say no. Versus if I call that person mean, I might cut them out of my life and say, I don't need mean people in my life. So it's just one example.
David, do you see other ways that this shows up in your home that you've picked up on and implemented?
So I among the one of the things that DBT and other of these third wave therapies that we call, so CBT, cognitive behavior therapy, let's say it was like this bedrock in the 60s and 70s, counter approach to what was the psychoanalytic approach, etc. And then CBT emerged and evolved further, right? And one of the things that it added is the bringing mindfulness into place, right? Mindfulness into place, which is awareness of what's happening in the moment without judging, as Ayla said, trying to limit judgment. So and then there's this other concept that Ayla maybe will come back to of the concept of a dialectic, the fact that two things that are opposites can both exist together at the same time. So Ayla often uses the word and, not but. She'll use the word and, right? There's a lot of pressure for us to get packed for this vacation, and I'm feeling overwhelmed, and I am excited, and I know we're doing our best to get it together, right? So there's two things can exist together. For me, the mindfulness is crucial. I really try my best with my kids, especially to tune into what's happening as it's happening. To tune in when I call turning off autopilot. All of us, we move very quickly through life, and it's a great thing to have to not think about what we're doing and trust that what I'm doing will get me where I have to go without me overanalyzing it. And at times, that's a good thing. And though it can also work against me. So I try to flip the switch to off autopilot to be engaged. What am I feeling right now? I'm noticing in myself, I'm getting anxious about having to leave to get somewhere on time. Like Ayla said, we got to get somewhere. We got to leave at 5 o'clock. I notice in me the anxiety building up. Let me try to address that and take action. But the first step is to bring that apparatus of awareness into play in manual mode. And that's intimidating because there are a lot of dials in the cockpit of this plane that I fly. There's a lot, but I need to slow myself down. I try to slow myself down and learn about my own internal kind of machinery so that I might make decisions in the moment, how to redirect the flight pattern or how to deal with the turbulence that arises. So I try to bring that as a parent, as a husband, and in all the work that I do. That's to me a crucial element.
I wonder, as you were sharing, it occurred to me that there is also this significant societal and cultural difference in how we are expected to manage our emotions, so to speak, right? Because one could say that CBT is really, if you were looking at it from like the worst perspective possible, like managing your emotions, just whatever. And I think that having gone through a lot of the learning and training and all the things, it's really not. It's really about accepting what those emotions are and then behaving in a different, like choosing your own reaction to be different. And so as I think about choosing that reaction, I think about how very different the societal standards are for if a woman is sad versus if a man is sad, right? Like men are not allowed to, so to speak, express those emotions in the same way. And on the flip side of that, there's this expectation that women not express frustration and that if they do, they're bossy or they're all these different kinds of things controlling, right? Like there's a lot of societal and cultural belief that it goes into our behaviors. And as someone who has a very strong personality, I've chosen to just like ignore that, right? Like people can talk negatively about me. I'm going to live my life. But for most people, and even myself, as strong as I am, I'm still impacted by how someone might perceive me if I'm going about what I think is best in those moments and choosing my behavior. And I think that is a struggle for a lot of people, right? That like they want to express their emotions, whatever it is, in a healthy way. And at the same time, have been taught that doing so, there is no right way, that you need to just deal or like whatever it is, that this is part of life and we don't talk about it or whatever it might be. Um, Ayla, can you talk a little bit about how that comes into play? Because I know you work a lot with women specifically, and being that we are in a patriarchal society, as much as there is negative impact on the male side, I do think that there is this unbalanced sense of emotional turmoil that we're all dealing with that I'm sure comes up with the work that you do.
Yeah, definitely. And I think different situations I might approach a little bit differently. So just to the example that you gave, I was working with one particular person in the tech industry, and she would struggle with crying whenever she was in meetings and whenever she would receive feedback, and recognize that if she's going to cry in feedback, how others might view her as like a woman who's too fragile, or how that might impact her ability to get a promotion, etc. So we did a lot of skills and tools on how to regulate her emotions in real time so that she wouldn't end up crying in those meetings. That didn't mean that she couldn't then process her emotion after the fact. And then we potentially even work on how to effectively express that the way that they communicate is not effective, or what might work better for them. And she also didn't want to cry in those meetings, right? Like that also took away from her feelings of self respect. So I think in different types of situations, you might go about doing things differently. And the reality is that like things aren't fair. And I think that it's okay to say that too. Is like, yeah, there are women are perceived differently at times, and that sucks. And I think it's okay to self-validate and validate the other person, and then figure out, well, what do you want to do given that fact, right? Like, do you feel like you can still work at this place? Does it feel like this is where you want to be despite that? And then what would be most effective given that's your choice? Or do you want to leave and find another job that you think might be a better fit? So I think whether it's something like this or something else that happens in life, I often hear this idea of like fairness. And unfortunately, well, life isn't fair. And this isn't fair. And there's a lot of other things that you're going to go through in life that aren't fair too. And I know that's a message that I try to share with my kids too, when they really like, they get really stuck in like the black and white thinking of like, but it shouldn't be that way. And I'm like, I know. And it is. So what are we going to do now? Right. So again, like, I think it depends on the situation. But yeah, some tools in different types of, depending on what the client's really looking to gain in that situation.
Yeah, that's pretty. It's a lot of checking in. As I go back to this idea of checking in with ourselves and being able to understand that life is fluid and life is unpredictable. Aspects, as Ayla is saying, might not feel fair, but what we do have, right? Control what you can control and let go of what you can't. What right acceptance of is very powerful, and bringing that to bear as we go through our life makes all the difference. So I personally, and I think in our work, we like to teach people the tools, the methods that they have now at their disposal, but that will only be as effective as developing and harnessing the apparatus for self-awareness, knowing that in a moment, in a given point in time, there is something, there's turbulence. Again, I use this analogy of flying a lot. There's turbulence right now, and it comes on suddenly, unpredictably. There's turbulence. And if we're going to panic, then it's going to feel even worse. But if we can call upon skills that Ayla is talking about, and Stacy, you've referenced, right, skills that I can apply in the moment, I will fare better through that flight, but I need to train myself ahead of time. Pilots go through training. They go through scenarios. They're put through, what's the word?
Simulation.
Simulations and mock experiences And that is important for us to strengthen the use of the tool so that when the moment comes, it's we're more comfortable and more confident to pull upon that skill set. And it could be in anxiety, and it can be in experiences of emotional dysregulation, and it can be in moments when we have impulsivity, hyperactivity, lack of focus, feeling overwhelmed, feeling disorganized. These are just, and of course, in any condition, there is a formula that I find that we're speaking to now that I hope those of us listening out there today can begin to think about in your own lives, where you can begin to identify the tools and how you might go about going through a training, whether it be with a therapist, with a coach, listening to Stacy's podcast, other resources to help bring out your awareness, because that's the long game here. That's the long game.
I think it's interesting to hear you talk about it as being this simulation with a pilot. The way that I've described it before is a kind of remapping those neural pathways, right? The response that you have when you experience something that you've experienced before, and your body has been like, "Oh, this is what we do when we experience that." And then teaching it, "Nope, we're not going to do that. We're going to do this other thing." Is the idea of visualizing like the Grand Canyon, right? Like when you've experienced this before, you are like the Colorado River running through the Grand Canyon over and over again, and it is now deep and wide, and we have to, like, climb out of that and start to create something similar, but, like, we're always going to gravitate towards that big canyon, and we have to be able to pause and stop ourselves. And I think where I'm especially curious is for women, the more that I learn about our physical bodies in terms of the luteal and follicular phases and how those hormones affect our bodies just on a monthly basis, right? Like just monthly, we have a huge influx of hormones that are affecting the way that our body is responding to things. And that's not even including like the physical changes of puberty, the physical changes of your childbearing years, the physical changes of menopause, and all of the hormone fluctuations that are happening in biological women's bodies as a result of just who we are, and how much more difficult that is to do those behaviors when we have and I think when I was younger, there were too many Midol commercials, right? Like, I don't know if this is a generational thing, but I always just perceived PMS as like a ridiculous thing, right? Like, it was just people were acting like women didn't have control over their bodies, and like kind of 1950s, we need a lobotomy type behavior is the only way to be. And I think really I am interested in helping women educate themselves on their body's own cycles to be aware of like, hey, these 2 weeks, you're going to be more prone to like hunker down and be in bed and like really just, recover. And you might feel more depressed versus like these 2 weeks, you're going to feel creative and energetic. And how can we lean into those sort of things? And really, that's a life cycle for women. And I'm wondering, Ayla, especially as someone who works on the mental health side in women's issues, like, how do you how can we help people understand and tap into all of the things that we've talked about in context of our bodies constantly changing?
Yeah, Stacey, I love that question because before I got into this area, I was hoping that was all BS, right? Like, oh, that's just all the things that they used to say about women, like, that's not us. Like, that's just their way of putting us down. I remember my brother teasing me when we were younger, like, we were three girls and he'd be like, oh, everybody has PMS. And it was just a joke, right? And the reality is, I can almost clock every one of my clients' periods based on their presentation. And my own, I know when I'm getting my period because I can tell that things that normally don't bother me all of a sudden feel really big. And so, to your question, a few things that I would say. One is we want to decrease our vulnerabilities just generally because the idea is that when our vulnerabilities are high, we're more likely to react more strongly. Now, our period is a vulnerability. We can't control it. We know what's going to happen. So, what I suggest is if we can work on all of our other basic vulnerabilities. Are we eating well? Are we sleeping well? Are we exercising? Are all of those things in order? Because soon our hormones are going to go a little bit wild and we're going to feel things more deeply. So if all of those other things are in place, hopefully instead of us going up a mountain like this, we're just going over a little hill. So that's one thing that I talk about is preparing yourself. Another is this idea of mindfulness. And I know I'm bouncing a little bit here, but Stacey, when you said before this idea of like, you say I'm at 80% and like there's 20% more, that's you using mindfulness. And the reason why you're more effective is because you are catching in that moment your urge to stop at 80. And then you're saying, what's most effective? I'm going to go for the next 20. And so I, to David's point as well, like mindfulness is such a huge component of our mental health. If we can notice what's happening in real time, that makes such a difference. So I really talk about mindfulness as well. Notice where you are in your cycle. Notice that these emotions feel bigger for you. Notice that these interpretations seem to be coming like every other second rather than maybe once an hour like it usually does. And even that awareness sometimes is helpful because you're able to say, this is going to be short term. Things are feeling this way for a reason and not because I'm depressed or not because I'm an anxious person all of a sudden. It's because there's biology happening here. And so I notice what's happening and I put it in my body's going through changes, but I'm going to do my best to use my other tools and not take this all so seriously and act on it because I know in 2 days' time or a week's time, this will not feel big to me anymore. So mindfulness. And then using the tools that you have, just maybe needing to use them more frequently. What I will also say is something that I always tell the women that I work with to consider is whether you're on birth control and what birth control you're on. I go to these rounds with psychiatrists and all different professionals weekly. And one of the questions that is often asked is like, okay, which is the birth control that will most likely help with depression or anxiety? And unfortunately, the answer is different for everybody. So something that I would also consider, not my area, but I'm just suggesting, is that if you do notice a huge shift in mood symptoms after taking a certain type of getting an IUD or taking a certain type of birth control, to maybe check in with your OB and or your psychiatrist and see if perhaps that's not the right one for you. There's also, again, another avenue to take is oftentimes psychiatrists will prescribe SSRIs to help with premenstrual dysphoric disorder as well. So that's a third option depending on how difficult it is for you.
It's interesting to think about the idea that at one point, not too long ago, it was believed that emotional health had nothing to do with physical health. And here you are saying, like, hey, if you get an IUD, be aware that you might increase your anxiety. Like, it's such a fact now that we know that we can incorporate. And I think that there's a lot of different lifestyle factors that can impact those things. I love that you talked about getting solid sleep. I would love if we, as we wrap up, if you could each share, in addition to people being able to look into CBT, DBT, and by the way, I want to be very clear. There are groups and different things that you can do, but you can also find a therapist near you or virtually work with someone that specializes in that and can help you process those things personally too. And David, maybe you can speak to that through the Agave app and different things that you do. But before we kind of wrap on that, I would love to hear specifically some actionable things that people might be able to do to implement some of the changes that we've talked about. So I think we've mentioned things like getting adequate sleep, getting sunlight, exercise. We know that these things have an impact on our mental health and our ability to be more patient or perhaps compassionate, right? What are some of the things that if someone's listening today and they're feeling like, gosh, I have a lot to work on and I'm feeling overwhelmed with where to start, like what would you suggest are some of the things that they could do today?
So I think being that we spoke about a couple different areas, I'll speak to some of the action steps or things to do within my domains of expertise. And I'm sure Ayla will be able to provide some other ideas that complement her areas of focus. So in terms of action steps for those who are struggling with ADHD, first of all, if you're unaware, if you're sitting here today, again, listening, wondering, a lot of what I heard today resonates, but I never was, no one ever checked in on this. Check in on this, right? The first thing to do is to seek out an assessment, perhaps with a mental health specialist. And that's not the same as going to your general practitioner. I'm talking about sitting with a mental health professional who's knowledgeable in ADHD. The company that I work with, Agave Health, we're actually rolling out very shortly assessments for people with ADHD. This is not the same as neuropsychological tests. That's a much bigger, broader concept. This is just a 1 to 2 session conversation, a diagnosis with the mental health professional, see what's going on, differentiate. We talked about maybe there's anxiety, depression, other things going on, parse it out, figure out if that's what's even going on. That's our first step. Then we're talking about tools. Again, we talked about mindset and methods in ADHD space. So avail yourselves of a support system. It can be a therapist like myself. I'm available. You can reach out to me for coaching or therapy. My company, Agave, our company is available, or other people in your area. Get support. It could be just 4 meetings you can have with someone, and that can change your life. Right. Wrote a whole book, ADHD Refocused. That's a resource. But find the resource, and I'm going to go one step further. Find the community. Find the community where you can feel like you're seen, you're heard, you're not alone. And that can be done in many ways. There's an Attitude Magazine is a great resource where there's articles that come out all the time. And there's webinars. Again, at Agave, we have a community feature where people get together and talk together and share together and problem solve together. Community is crucial. You should never feel, I hope you would never feel alone in these struggles. Men, women, anybody out there. Those are a couple ideas that I would say off the top of my head. I could go on, but I think that's
Yeah,
a good
no, I think
start.
that's great. And I love the idea of community too, because my husband, who has struggled with his ADHD or his whole life and really sensitive rejection sensitivity, like very high. He's in a 20-year relationship and he's still worried about getting rejected sometimes, right? He found community in listening to podcasts of people talking about ADHD and how it impacts their life, and hearing that connection of I'm not alone in this and other people have it, and hear some suggestions that they have on integrating into life and those kind of things were huge for him, right? Like more so than any of the lifetimes of therapy that he'd had, more so than the medication, more so than anything. He finally felt seen and heard and was willing then to implement some of the things that those people were saying. So I think that's a great idea, and I love that. Same question to you.
So I happen to agree with that, with the concept of community and finding community, not only necessarily somebody who struggles in the same way that you do, but community generally. Whether it's meeting people who live in your area, going to a JCC or a YMCA or any sort of community place where you feel like you're not alone. It gives you opportunity to give back, which actually is medicine for you more than it is for the person that you're giving to. That's also a skill in DBT, is contributing to others. So especially if you're somebody who's depressed, creating a community, creating a way for you to give back to help others is huge. But going back further to your question, is what I would say is you had said the listeners are going to be saying, there's so much I need to do. And I think we all feel that way every day. And so what I would suggest is think about the ways in which you feel you are suffering or feeling most overwhelmed by, and focus on that area first, right? Because if we try to take on too much at once, we'll likely not get anywhere. But if you pick one thing that you feel like you're lacking the most, and I talk about this with my clients in terms of values, right? Like, do you value community? Do you value work? Do you value family? Do you value whatever your values are? Think about which value maybe means the most to you or means a lot to you, but you've done the least in taking steps towards. And I would pick that one and come up with some goals that you want to attain towards that value, right? So if it is community, then maybe a goal could be reaching out to 4 different places near you and finding out what they offer and whether or not that feels like a good fit. And so also, I think it's important to think of is that values are the journey and they're not a destination. Goals are destinations, right? None of us say, I value community, okay, I just helped someone. I could cross that one off my list. Right. And so I think to David's point before is it's always a process. And so I think if you pick one thing and you start taking steps toward that value, you'll start to feel better. And then you might change that value and say, you know what, I'm feeling good in that area for right now. And I want to focus on this. But I think that what I would suggest most is just picking one thing. And even as it relates to sleep, eating, I would pick one. Let me focus on my sleep, or let me focus on having 3 meals a day, or let me focus on exercise. Pick one. Trying to do all at once is not going to happen.
Totally agree. Well, thank you both so much for being here. I loved the conversation. I really enjoy your interactions together as well. This has been fun. I don't often have multiple people on the show at once. So thank you so much for your time.
We're thinking, Stacy, of launching our own podcast. We're brainstorming ideas, and we came up with the name Figuring Sit Out.
There you go. Yeah, you definitely
But
want
that's as
to.
far as we're going to go. That's as far as we're going to go. We're just going
You
to come up with a
definitely.
name, but we're not going to really do the podcast because that would require too much executive functioning, all of our anxiety. But we like brainstorming the ideas. But if you have a listener out there who supports the idea, let us know. We have
And somebody else
websites.
wants to do all the work and just
Right.
have you show up.
Exactly.
Yeah.
And we'll show up. We're good at showing up. We're very good at showing up.
I think it's interesting. I'm not quite sure where it falls into my personality. I do think it's partially a ADD thing, but I'm very much like a project focused person. I lead into like areas where I get like super into something for a period of time and then I'm like, "Oh, I've mastered that," and I move on to something else. And the podcast is something that I've done for 15 years now, and that feels like a huge accomplishment for me, right? Like that it's looked different and the topics have changed, but I do feel very like proud of the fact that I've been consistent with something for that long. So, yeah, I'll sit in this podcast for a while. Thank you both so much for being here. Can you remind listeners where they can find you on your website, your book, all the things?
Sure, sure. So we are currently where we're in transition right now in terms of our marketing and whatnot. Right now, my website is drsitt.com, spelled out drsitt, SITT.com. And we are moving, Ayla and I together, we're launching a new company called Elevate Psychology. So that'll be live in 2-3 weeks. We'll have our website up. So our listeners out there, if you want to check us out, you can go to elevatepsychology.com and you can find all of our resources there. But for now, if it's in the next 2 weeks, in May and early June, you can go to drsitt.com and you can reach out to us from that website. And my book is up there, and Ayla's information will be available on Elevate Psychology. She runs new moms groups, therapy groups. I run therapy, and an ADHD support group is starting up soon. So you can just reach out, say hi. Love to chat.
Thanks for having us, Stacy.
Thank you both so much. Listeners, don't forget that we've put a list of resources into the show notes for you at realeverything.com. And if you'd like to head to patreon.com/thewholeview, you can get all of our shows delivered to your inbox ad-free, which is also a really great way to support the show that we create and produce ourselves. And of course, if you enjoyed the show, I would be so appreciative if you could leave a review saying so. It costs you nothing except just 30 seconds of time. That makes a huge difference in my being able to continue to do this work. And again, don't forget to follow or subscribe in whatever podcast app you're using. As always, we appreciate your willingness to be open to grow through your own personal changes. No one is perfect, but in listening, learning, and unlearning, we can choose to become better versions of ourselves for ourselves.